Good evening. I'd like to take some time to tell you about the use of humor in the hospital setting. So imagine you have a loved one in the hospital receiving bad news. Do you think that's a humorous situation? There's an old saying, laughter is good for the soul, and I'd like to take you on a journey to show you how good it is. So it's likely that at some point in your life or in a loved one's life, you're going to experience a hospital stay that's unexpected. I've worked in the hospital for more than 10 years, and I've seen where the use of humor can improve a patient's stay. The use of humor in the hospital setting has the ability to accomplish many things, amongst them making a deeper connection or helping us make a deeper connection with our patients and our families, speeding the recovery process, and lastly, providing unity and a sense of family with our physicians and staff. First, let's talk about how hospital staff use humor in our everyday environment. Hospitals around the world have brought humor and the therapeutic benefits of humor to their patients. Julie Pryor wrote in the Journal of Rehabilitation that was published in 2010 that humor can assist bonding on a personal level and can be applied in the clinical practice. Pryor considered that an inclusion form of humor, one that actively encourages patients to interact with the support one another, can result in camaraderie and beneficial peer support. This may be especially helpful for those patients who are new to the clinical environment. In the Journal of Nursing and Residential Care, published in 2013, Robin Graham wrote that being in a hospital setting can induce physical and psychological stress. Graham summarized some of the positive effects of laughter, such as improving immune, cardiovascular, and respiratory function, neutralizing stress hormones and increasing the relaxation response, assisting with pain relief, lowering blood glucose levels after a meal, and releasing endorphins, serotonin, and dopamine. Thank you. The release of dopamine can promote positive thinking and creativity and reduce depression. Some hospitals have even introduced a humor program in their hospitals, where staff members and volunteers bring humor to patients by using humor carts and resource centers. Humor carts are similar to hospital carts, except for in the case of humor, patients select humorous books, videotapes, and other paraphernalia to brighten their day. Next, let's talk about how patient outcomes are changed when humor is used as a plan of care. Patients are affected positively by the use of humor while experiencing an unexpected medical emergency. Dr. Paul McGee wrote in his book, Health, Healing, and Immune System, published in 1999, that one researcher has suggested that it may not be so much what the positive emotion does that is key, but what it prevents. He feels that the effect may be due to the disruption of production of neurotransmitters, hormones, and other substances. Humor has the power to speed up the wound healing, may be due to the capacity to lower blood sugar levels and blood levels of cortisol, which can surpass natural killer cells and lymphocytes activity and suppress the production of antibodies. Lastly, the use of humor in a hospital amongst the staff can help create an atmosphere of teamwork and family. Dr. Michael Carr, an international business speaker, presented in Humor at Work and author of Humor Advantage, published in 2013, says the amount of humor, the amount or type of humor you'll find in any workplace depends almost entirely on culture. We've seen that in the hospital today. Carr says dozens of surveys suggest that humor can be at least one key to success. In closing, when humor is introduced in the healthcare setting, it has the power to bond the patient and the nurse that is caring for them, change the clinical outcomes, and create a sense of family and teamwork amongst the hospital staff. So now that you've heard how humor is used during an unexpected medical event, you will be more open to it when you have to experience that event.